Hey guys, welcome to Tuesday Tea Time. TikTok was down for 12 hours and came right back, but I fell in love with long style content, so we're back to answer some of your questions with some cinnamon chai lavender tea of some sort. I asked you guys on my Instagram to ask me any nursing related questions and we're here to answer them. I'm so grateful that you guys have asked me questions and really trust me with my information or advice that's nursing related. But this is super fun because now instead of rushing on a TikTok to talk to you guys, I can actually take my time, read the questions, and answer them to the best of my ability. And there's a lot of them here, so let's read some of them. Hold on, let's put my phone on do not disturb so we can do this video in one shot. Okay, first question, what is a normal potassium level? Anywhere between 3.5 and 5.2. That's a real nursing question, but let's dive into the actual nursing advice. First question is tips for studying in nursing school. My tip for studying, everyone studies very differently. Some people study in groups, some people study independently. What worked for me is that I always studied solo, independent. I felt like when I worked in groups or tried to study in groups or anything, I was never focused because everyone was talking the whole time and I never felt like anyone was actually studying. And it's cool to like hang out with nursing friends or like nursing colleagues or whatever it may be, but if you don't learn the same way, like let's say you're a visual learner or they're an auditory learner or a hands-on learner, everyone learns differently. So my best tip is that you have to find what works best for you. What kind of learner are you? Do you study better in groups? Do you study better alone? Another thing that I use as well was highlighters and different colored pens. And what that would do is that you would memorize different terms or different concepts in certain colors so that when you're sitting and taking your exam, you're thinking about that color and you're trying to remember what color that you wrote that certain topic in. And now those are just tips that work for me, but personally I think that the memorizing and the colors are a different part of your brain that actually starts working in memorization skills, and then finding what kind of learner you are is also like a huge part of it. Like myself, I'm a hands-on learner. Terrible at taking exams. If you explain something to me, I'm going to come back and ask you to explain it again. But if you show it to me once, I automatically pick up on it. Like I just need to visually see it and then touch it myself, and then it completely makes sense. I love this one here because a lot of my content on TikTok is all about funny family and patient stories, but it is actually very serious because you do have a license on the line and you do have a professional standard as a nurse that you need to be held accountable for. So this one says, best advice on rude patients and family members. When you're a new grad, you have that adrenaline, the patient and the family members are yelling at you and you're like, oh my God, I don't know what to say, I don't know what to do. Best advice, let them yell. Just let them get it off of their chest. Stand there, professional, straighten out your badge, take a deep breath. Let them talk, let them vent. They're probably not yelling at you personally. Sometimes they are, but more than half the time they are not yelling at you personally, and they are just upset with the situation. They're upset with the doctor, they're upset with the social worker, they don't want to go to the nursing home or to the rehab, they want this care instead of this care. It is their choice of care, so right as the patient. Another trick I have too, if you're standing above the patient and the patient is laying in the bed, sit down, don't sit on the bed, sit next to them, pull up a chair or something, or even like squat next to their bed is something that I do more than often. You get down to their level, they're actually more understanding and they actually calm down almost immediately. It's pretty crazy. This one says, graduating in May, help, resume help, applying when, help, helps and help. Best thing on a resume. I do have my own resume and I wish that I could share it with you guys so that you could see the template, and I'm thinking about doing that and just like changing all of my actual real information because it says, you know, where I work and everything. I would never share publicly, but I'm thinking of changing it and sharing with you guys just so that you can see it and see the template. Is that something that you guys would want? Comment below if that's something that would help you with your resume or kind of guide you more in your resume journey. Best advice for a resume is to put things that are most relevant. If you're graduating from high school, of course put all of your certifications that you might have in high school, any awards that you've won in high school, anything pertinent in that time. If you just graduated college, of course you're putting what college you graduated from, with what degrees or any certifications you might have. If you already have a CPR certification, or if you have any types of awards of any sort, like high honor roll, perfect attendance, like they want to see that stuff because it looks great on a resume. So put stuff that's most important. Don't put anything social media related. I've seen that before online. That's crazy, absolutely crazy. People are plugging their Instagrams on their nursing resume. Don't be ridiculous. Put stuff that is professional and nursing related and stuff that they actually want to see that's relevant to the job that you're applying for. And the other part of that question is when to apply. I mean, I guess it's different in every state. It depends on when you take your NCLEX or when they allow you to apply to certain positions. I graduated during COVID, so the rules were a little bit different at that time, but we were able to apply to the position before the NCLEX in hopes that you were going to pass the NCLEX, and then when you passed, you could finally contact that specific manager and then let them know that you passed, and then you got to see if there was a specific position open that maybe you were interested in applying for. But every state is different and every facility has different rules, so definitely look into that. Okay, I love this one. This one says how to set up your day, meaning assessments, timing mainly for med-surg tele floors with meds. Basically, it's a time management question, the way that she was wording it. Worded it a little bit different, but she's asking about time management. How do you manage your time, especially on a busy med-surg floor? So as you guys know, I am a float pool nurse. My schedule is different shift to shift, and I basically work on floors wherever they need a nurse every time I work 7 to 7. Every nurse does it different, but the way that I do it is I'll get my morning report, I'll sit back down, look up my patients a little bit more, and sometimes you get distracted. The call bells are going off, the patients have questions, patients are going for tests, or stuff is happening at the change of shift. But in a perfect world, which we all know there's no such thing, is I'll get report from the night shift nurse, sit back down, look at my patients a little bit more. But I try to bundle my care. That way I'm not passing meds throughout the entire shift. So what I'll do is I'll start my morning med pass at 8 a.m. and I try to pass meds from 8 to 10 a.m. And then I take a little break in between to either help patients with morning care or their breakfast, or, you know, if they're going to test or whatever the situation may be, from about 11 to 12. And then I usually start my afternoon pass from around like 1 to 3 o'clock-ish. And then I take another little break in between. And when I say break, I don't mean I'm sitting there doing absolutely nothing. I mean a break as in from passing medication. So you're doing care or wound care, whatever it may be in between. And then I do my evening med pass, and then the shift is done at that point. So it's all about bundling your care and passing meds only at certain points in the shift. That way you're not passing meds for an entire 12 hours, because that would be crazy. And then of course in between you want to make sure that you're documenting. And then if you're giving medications, everything is documented. The care is documented. Of course all the medications are documented, but where I work we scan everything anyway, so it documents as you're giving the medications. You're assessing your patients, the wound care, all the different stuff that goes into actually being a nurse is all in between the med passes, or even while you're giving the meds. How long did it take for you to develop self-confidence in your nursing skills as a new grad? So I graduated during COVID. So my experience as a new grad was definitely far from the average new grad's experience, meaning my orientation was cut short. The stuff that I saw as a new grad was stuff that you really don't usually see as a new grad, as in I body bagged over 40 patients in my first year as a nurse. I got very good at CPR in my first year as a nurse, unfortunately, but the best news is that I've learned so much in my first year as a nurse that I got to take all of that knowledge and bring it with me up to this point, which I think really made me into the nurse that I am today because of the amount that I saw in such a short time frame. Relating to this question, they're asking how long did it take to develop self-confidence in your skills? Honestly, I would say probably a solid 2 years. I've been a nurse about 3.5 years now, a little bit over 3 years. And finally now I definitely feel confident in what I'm doing, but I'm also not afraid to admit when I am not confident or when I have a question or when I need help with something. The worst thing to do as a nurse, if you've learned anything from this video, take this with you. Worst thing to do as a nurse is to guess. If you don't know something, ask. Ask for help. Ask a seasoned nurse. Ask somebody. Never just guess, oh, I think I saw it done this way, or I think this is the answer. I think this is the right dose. No. If you don't know and if you're thinking about it, ask somebody. Remember, it's somebody's life on the line. This isn't a game. You can't press rewind. You can't press undone. This is somebody's life. This is a real person. Treat them as if you would your own parent, your own sibling, your own friend, your own neighbor. Treat them as a human being. This is not a game and this is not a mannequin anymore. If you don't know, ask. And I think that comes a lot with the confidence and building confidence as a nurse and not being afraid to ask questions. Tips for new grad on nights for med-surg tele floor. So that was me when I was a new grad on that COVID floor. It was originally a med-surg tele floor, but we still stuck to the roots of it being a med-surg tele floor when it was a COVID floor. And I was on night shift at the time. So I was on night shift as a new grad nurse for a full year. It was actually over a year. I think it was like probably like 1.5 years. But I was on night shift, and honestly, I love the shift itself. Like, I love the patient care. I love like the flow of the shift and like the vibe of the shift. The only reason why I switched to day shift is because of the lifestyle. And I felt like I couldn't really grasp like a good schedule. I was awake at all points during the day. I could never sleep. I never saw my boyfriend. I never saw my family. So it just didn't work out for me. But my sister's been on nights for years and she absolutely loves it. So I think it depends on your lifestyle, and it also depends on your own body. If your body can handle it, and mine certainly could not. So my best tip for you is to see if your body can handle it. And if it can, that's great. You're working nights, you're making extra money for just working at a different time of day. If your body cannot adjust to it and you just feel drained all the time, maybe it's a sign for you to switch to day shift. Also, what worked for me is a lot of coffee. I was drinking such an unhealthy amount of coffee. I would drink coffee before the shift, during the shift, after the shift. As soon as I woke up from the shift to prepare for the next one, I was drinking an unhealthy amount of coffee, but that's what worked for me. So that's one of my tips. Coffee, sleep, make sure that you're taking care of your body. And also what helped me sleep was melatonin, which I know that wasn't healthy for my body to take it as often as I did, but that's what worked for me, and that's the only thing that helped me sleep. So off topic, but married, I need all the tea. Any advice for anatomy and physiology? I mean, at this point, I took those years ago, so I don't really remember every single point of the class. I took that right out of high school. I graduated in 2017, so that was quite a while ago. What I do remember from that class, like the only thing that helped me pass was memorizing. And I know I talked about memorizing in different colors, but for anatomy and physiology, honestly, I still have them in my armoire over there. I made flashcards. I had like 500 flashcards of all the different terms, and I put pictures on them. Yes, it was time consuming, but it was also a way of studying, because as you're making the flashcards, you're memorizing what you wrote. So my best advice is use flashcards, use pictures, and then just repetitively. I remember I brought those flashcards with me everywhere. I brought them in the car. I brought them, if I God forbid, the grocery store. Like, I was flashing through those flashcards, and I actually got an A in anatomy and physiology 1 and 2, which was crazy for me because I was never really an A student all throughout nursing school, but that was the class that I got an A in because I memorized everything. And I just, as soon as I sat for the exam, I'm like, oh, this is this, this is this, this is this. Like, the flashcards just played in my head. Not the TikTok fan screenshot popping up. I like this one. I feel like this is a lot of us, although we don't like to admit it. So this girl asked, a little advice on emergency situations. I feel like I freeze up. So I feel like that's all of us to a certain extent. My best advice is, don't pretend like you know everything. I am constantly in rapids or in codes with nurses. Maybe they're new nurses, maybe they're seasoned nurses, and they act like they know everything. Don't be that nurse, because then nobody's going to want to help you. Accept the help. That's why they're called rapids. That's why they're called codes. Accept the help. If somebody's like, do you want me to draw blood? Do you want me to take a blood sugar or get an EKG? Yes, please help me. That's why we have teams, and that's why we have policies and protocols, that when these certain codes or rapids are called, like, we are summoned to help. So don't act like you know everything. And also, if you don't know something about the patient, when the doctor is asking you in the time being, don't guess or make it up, because I've seen that before too. Use your resources. Pull over your screen, pull over your computer, or ask somebody, hey, can somebody look it up real quick? I'm not sure. I don't remember. So there's nothing wrong with asking. And I feel like when you ask and you accept help, you're actually a lot more calm in the situation, and you shouldn't freeze up as much. But that also comes with time and confidence as well, and that's also a skill that is something that's practiced in nursing. Last one, but best one. I talked about this on my podcast with Nurse Dawn, but I love talking about this stuff because I've gone through it myself, and I know that a lot of nurses do, and it's something that's so common in nursing, and it's nurse bullying. And I'm actually going to make an entire video talking about that and how to deal with it. But this girl asked, any advice on dealing with mean nurses? Def got a case on eating the young. But the one thing I want you to know is that it says more about them than it does about you. I'm not talking about the older nurses versus the younger nurses. I'm talking about nurse to nurse, human to human, person to person. Bullying says more about the person that's bullying than it does about the actual victim of the bullying. It's a part of them that they don't know how to control, a part of them that they want to portray onto you because maybe you look happier than them, maybe you're more successful than them, or maybe you're just straight up a better nurse than they are. But there's one word to keep in mind: jealous. They're jealous of you. Jealousy is such a thief, and nurses that bully each other are jealous of one another. It happens to me every time I go to work. A lot of it has to do with my social media, because at work I don't talk. There's no reason that somebody should be mean to me at work or somebody should be saying anything bad about me because I don't say anything at work. And I know that there's a lot of nurses like that in the workplace, so if there's anything, please remember they are jealous of you. They're jealous of your lifestyle. They're jealous of how you are as a nurse, how you handle yourself as a nurse, how you take care of your patients. They're jealous of how happy the patients are with your care. Like, isn't that crazy? Don't we all want to support each other and provide the best patient care? So I am so determined on my social media and as a nurse in general to put nurse bullying to a stop. And I know that's going to be easier said than done, but nurse bullying is so real. I've experienced it myself. I know that so many of you guys have, and I want to hear from you guys. I want to hear your crazy nurse bullying stories. Please DM them to me. I am now so invested into my social media and actually communicating with you guys and engaging with you guys, so I want to hear your stories. If it's nursing related, life related, relationship related, family related, whatever it is, I want to hear from you. I want to talk to you, give you my advice, and it means so much to me to be that figure that you guys trust. Be that person, that influencer. You guys know that I hate that word. I literally could vomit saying influencer, but if that's what you guys want to call me, then that's what it is. I'm so proud to be that influencer that you guys trust or want advice from. So this is the time to ask me. I am so invested in making these YouTube videos and keeping up with this long style format of content. I actually had a crazy dream on the night that TikTok was banned, that I have a feeling my YouTube is going to be even bigger than my TikTok. And that is my goal for this year. My goal is to earn a YouTube plaque. You heard it here first. In 2025, I will earn a YouTube plaque. And I'm bringing you guys along with me. So thanks for coming to Tuesday Tea Time. Join me next time and ask me anything in the comments down below. Make sure that you like and subscribe and turn on your notifications so that you can keep up with me. And my username is Natalie Ray on all social media platforms, so you can find me easily across all networks. And bye-bye. See you next time.